Why is an oncologist crucial for interpreting brain tumor results? Imagine trying to solve a complex puzzle with many missing pieces. That's what diagnosing a brain tumor can feel like. Brain tumors are not one-size-fits-all. They come in many types, grades, and genetic profiles. That's why having an oncologist, especially a neuro-oncologist, is so important. They are trained to interpret the intricate details from multiple diagnostic methods like magnetic resonance imaging scans, computed tomography scans, biopsies, and tissue analysis. These tests provide a lot of information, but understanding what it all means requires specialized knowledge. Brain tumor images can sometimes be tricky to read. For example, aggressive tumors like glioblastomas can look very similar to other conditions such as metastases or even infections like abscesses. Without expert interpretation, there's a risk of misdiagnosis. That's where the neuro-oncologist works closely with radiologists, who analyze the images, and neuropathologists, who examine tissue samples under a microscope. This team approach helps combine visual data with cellular and molecular analysis, giving a clearer picture of the tumor's nature. Molecular genetics has become a game changer in brain tumor diagnosis. Tests now look for specific genetic mutations or chromosomal changes that help classify the tumor more precisely. The World Health Organization's latest classification emphasizes these molecular features because they can influence prognosis and treatment options. For instance, knowing whether a tumor has certain mutations can determine if targeted therapies might be effective or if the tumor is likely to be more aggressive. Once the diagnosis is clear, the oncologist uses all this information to determine how malignant the tumor is, its type, and how fast it might grow. This helps in choosing the best treatment plan, which might include surgery, radiation, chemotherapy, or newer targeted therapies. They also plan for ongoing monitoring, using follow-up scans and sometimes biomarkers to see how well the treatment is working and to catch any signs of recurrence early. In short, interpreting brain tumor results is a complex process that involves understanding multiple layers of data. An oncologist's expertise ensures that every piece of information is accurately analyzed and integrated. This careful interpretation guides personalized treatment plans, improves outcomes, and helps preserve brain function. Remember, each patient's situation is unique, so always consult with healthcare professionals who can tailor advice specifically to your needs.